Hello and welcome. My name is Tracie Rogers. This is On the Couch. Today I'm here with drama therapist Karline Brathwaite, and we are talking about adolescent health. In fact, we're naming this segment Adolescent Health, a Call to Action.
Yes.
And one of the reasons why we have a call to action is because so many of the challenges that young people face are preventable.
Absolutely.
And the only way we can prevent that is if we start going from now and not become reactionary.
Absolutely.
So in today's segment, we're going to talk about what are some of the adolescent health concerns that we need to pay attention to. And then we're going to follow that up by talking about what we can do today to help our adolescents and prevent a lot of the challenges that they're dealing with.
Absolutely. So unfortunately, what the World Health Organization recognizes is that there are patterns of behavior that across the world adolescents tend to be challenged with. And some of the things, and we see them in the school system, we see them in our homes, behavioral disorders. A lot of young people having very difficult times managing themselves, managing their emotions, regulating themselves in school, managing their anger. We also see things like self-harm. Right now in Trinidad and Tobago, we have a huge challenge with self-harm and suicidal behavior.
I want to stop and talk about self-harm just for like half a minute.
Of course.
Because we work in the school system in Trinidad and Tobago, and we work with young people. So I don't know how aware people are about how rampant self-harm is.
Absolutely.
So self-harm is hurting oneself, and we have a lot of that happening in our schools.
Yes, we do. In the Ministry of Education, they're doing some preliminary research, and last year, 2016, they got over 300 cases of reports of young people harming themselves, cutting themselves, ingesting substances and ending up in our hospitals. And unfortunately, parents, teachers are unaware of how to deal with the situation. So clearly, it's something.
We have an issue.
We have an issue.
And you spoke about suicide, and you and I were talking about this before we started taping.
Yes.
That the World Health Organization is saying that suicide is the third highest cause of death among adolescents
in this region. Unfortunately,
region.
and Trinidad ranks 41 out of over 100, and I think it's 150 countries right now worldwide when it comes to suicide rates. So we have an issue.
We have a problem.
So that is why globally there is a call to action. We need to do something different, and we need to do it now. We need to think creatively and innovatively, and the reality is that a lot of these challenges can be prevented. So if at home we can begin now to attend to our adolescents in a different way, we can see a lot of marked changes in the adulthood of these individuals.
Why do you think adults are struggling to deal with adolescents in a different way?
There are several reasons, and I want to believe one, that some people tend to think, they're young. Adolescence is a time for young people to experiment and to try different things and, grow out of it.
It's a phase.
Yes, it's a phase, yes.
I think that's, a lot of times we miss opportunities because we think it's a phase.
Yes.
Sometimes we treat it as, we know we went through it and we survived it, so it's easy for us to dismiss it.
Yes. And then we think, well, they can be enduring stress. What kind of stress these young people have? They'll bounce back. And unfortunately, yet a lot of young people don't know how to articulate or to talk about some of the challenges that they're experiencing in school that are new to this generation.
So I want to talk about new to this generation for a little bit, because one of the things I think that has us stuck from really treating with our issues, that we assume that adolescents are growing up in the same environment that we grew up in as adolescents, and they're not. And there are many things that have made this environment different.
Absolutely.
Globalization, social media, just access to information and technology, the fact that you're in your house and in the world. So in effect, the world is raising your child.
Absolutely.
Yeah.
Absolutely. You are not the only person, and that is the scary part. Your child spent most of their adolescent life in school, outside of the home. So there's so many different factors that are rearing your children.
And most of that time in the world because of the internet.
Absolutely.
So we're coming back in our second segment to get to those action points. What are the things we want to do now to make our adolescent health outcomes more positive?
Yes.
Thank you so much for joining us, Karline, and I will be back.
Yes.